It's a pleasure, as always, to bring on to the program Kansas U.S. Senator Jerry Moran, who joins us this morning. Senator, good morning. How are you?
Greg, good morning to you. I'm pleased to be with you and our listeners this morning.
I don't know what type of adjective you would use to describe the time right now, but it's all new, and and it involves everybody and anybody who is amongst the living right now, because what a time we're living in right now.
Greg, that's so true, and I know none of us like the circumstance we're in, when none of us like to be told by anybody what we're supposed to do or can do or can't do, and all anxious to get us someplace back to whatever normal, the new normal will be. I think that, Americans generally think that this kind of thing is certainly going to happen in the United States, and those of us in the Midwest, us Kansans, we're going to think it's going to happen on the coast, and yet we know that there are Kansans who have died, and we know that there are Kansans who are in the hospital, and we know that there are Kansans who have tested positive. Obviously, we got to figure out the right balance between health care and the economy, but it is important for people to realize that what we do as individuals, our behavior has a consequence on other people and their health, and therefore we're trying to figure out what that balance should be. I'm away from Washington, D.C. I've been home about 2 weeks. The Senate is not in session, was scheduled to go back on Monday. That was delayed for a couple of weeks, but we're on 24-hour call, and we are still by technology, whether it's as simple as a phone call or as technology is all that I'm trying to learn these days. The other opportunities we have to be together, the members of the United States Senate are still having conversations, and still having conversations not only with ourselves but with the administration, from Secretary Perdue to the Treasury Secretary to Dr. Fauci. I've had those discussions all within the last couple of weeks.
You talked about that in the aspect of talking with fellow senators and the administration. How much do you keep in contact with state officials, Governor Kelly, Lieutenant Governor Rogers, Dr. Norman, and others?
Well, Greg, I should have been longer in my list, because Governor Kelly and I have talked. We are working closely with Dr. Norman. I know him from prior to his being the Secretary of the Kansas Department of Health and Environment, the Adjutant General, which we have a new one, General Weishar, State Emergency Preparedness folks, FEMA, Regional Office in Kansas City, the Army Corps of Engineers in Kansas City, and perhaps most importantly, conversations with Kansans across the state. Yesterday, for example, in your home territory, I was with the citizens, community leaders, agricultural producers, livestock packers in Garden City, trying to make certain that I know what's going on in southwest Kansas, but it's been true from east to west. And I am on the phone really throughout the day. Sometimes I wake up and the schedule looks like that it's not too packed, but every call results in somebody having a problem or an issue or something that we need to help on. And that, we passed 3 pieces of significant legislation in the Congress, signed by the president, and most of the work. Now, we anticipate there being a 4th phase in legislation, and that's being talked about and worked on remotely. But so much of what needs to take place now is getting the legislation that we have passed to be of value to Kansans. In other words, that it works, that people don't slip through the cracks. And there are a series of things happening in both regard to health care and in regard to economic survival. And in some ways, they're very related because many of the efforts that Congress has undertaken is to keep people working, or at least keep people on the payroll, even if they cannot work because the business is not open, the business doesn't have enough income to pay them, or they're home because of COVID in their family, or they're working from home. We're trying to keep paychecks coming to Kansans and Americans, but we know that there's going to be people who slip through the cracks, and so our work at the moment is trying to fix problems and make sure that no one is forgotten.
I want to get to that in just a second, but a little bit on agriculture. You mentioned you spoke with representatives of the livestock packers down in southwest Kansas, and obviously, you've seen the concerns in the packing industry, specifically what's going on in Sioux Falls, South Dakota, with the Smithfield situation. How worrisome is it to those like a Tyson Foods down in Holcomb or others who have plants down there, and it's such a big industry here within the state?
Well, our meatpacking plants may have become the largest private employers in Kansas with the downturn in the aerospace and aviation industry in south central Kansas. They are a huge component of our economy, and they matter greatly to the livestock industry. Later today, and so the answer is how much concern they express it's what you'd expect. We're going to do. This is those I talked to from the packing industry. They would say we're doing everything we can to make certain our employees are safe and healthy. We're doing everything we can so that they feel that they are safe and healthy. But we see the statistics, we see the news in which packing plants across the country have closed. I can't imagine it's in the best interest of anyone that that to the packers or the producers that a packing plant close. So there's the incentive, I think, is certainly to keep those businesses open. But you have to have people who show up to work, and in that regard, it's not only the employees of a packer, but also the federal inspectors. And there has been reports of inspectors not coming to work. And again, if I can take this broadly, I've been pushing for weeks that the best method to get us out and back to normal again is more testing. In fact, broadly testing. Anybody who wants a test should be able to have one. Determine who is immune from the virus, because regardless of who ultimately says it's okay to go back to work, I think it's going to still have a number of people. A lot of people will jump at the chance to do that, but a lot of people will still be nervous and concerned for themselves and their families. What are they bringing home to their house? Who do they come into contact with? And if we could get people tested across the country so that we individually feel secure that we are not a carrier and we don't have the virus, that seems to me to be the best method while we wait for this vaccine to be developed. We need more testing. And that is what is trying to occur in plants across the country in the meat industry, is more testing, taking temperatures of employees, and we just need more testing capabilities, in my view.
And is it, besides that fact of trying to get these plants or trying to get more tests into the pipeline, is that also a part of for states trying to get PPEs? In other words, they need to come up with the money to be able to get those tests and those amount of tests that are needed to get to the state of Kansas in this case?
Greg, you're very perceptive that there's very much a relationship between the ability to test. So the country was not prepared for the magnitude of this circumstance, this pandemic, in regard to the ability to test and in regard to PPE, the personal protection equipment, the masks, the gowns, the gloves. It is surprising, somewhat disappointing to me that we can't respond more quickly. And yet, on the other hand, every day I have a conversation with a Kansan or someone who is now manufacturing PPE. We are getting there. Or someone who is developing or manufacturing tests. But you have to have, in order to give the test, you have to have the capability of the person administering the test, at least the test we have in higher quantity today. Somebody's going to wear a mask to do that. Somebody's going to wear gloves to do that. And so these two things are very related. We've got to get the supplies, the tools in the hands of our healthcare professionals as fast or faster than we're doing today to get us to the point in which we can test more people. And the tests perhaps are more available, but then what's missing is the swab or the reagent, the chemical, the substance in which the test occurs or is transmitted to the laboratory. So all those things, we're getting there, but it's not happening as fast as any of us would like.
Kansas U.S. Senator Jerry Moran is joining us on the Ag Issues program. Senator, you had mentioned the Payback Protection Program earlier and saw some of the figures that applications-wise, close to 20,000 applications by Kansas small businesses for PPP money.
Greg, I think this is an example of a program, at least to date, that while it had its initial problems, has been beneficial to Kansans, to businesses, to small business, and to the people who work for them. But you're right, and the early problems were we were asking the Small Business Administration to guarantee loans of $350 billion total, and they would do that in a matter of 2 weeks. And what they're accustomed to doing is $30 billion over a year. So a huge increase in the volume of the work at the SBA, and a lot of difficulties with computers and the portals to get connected to the SBA. It's my understanding that all but 9 banks in Kansas have made or are making these loans. And my impression is that the 9 banks that this just may not be something that they wanted to do. We think that the computer problems generally have been resolved, and nearly 20,000 Kansans, let me say it differently, nearly 20,000 loans, 19,915 loans as of yesterday had been made to Kansans. What this loan is if you'll keep your employees employed, the loan is for the amount of your payroll, interest, mortgage, rent, and if you keep your employees employed, then that loan can be in large part forgiven. And it's a program that is designed to keep people working, and businesses in Kansas are taking advantage of it. $3.73 billion came to Kansas in these loans, and the average loan was $187,000. So we're talking small business, and we're talking significant amounts of money. And it is in talking to bankers and in talking to businesses and in talking to employees, it's been something that's been very helpful.
Yet, many agriculture groups have concern and really pushed SBA to allow farmers to be able to part of that, because in many essence, farmers are small businesses as well, but yet that's not able, or at least SBA has said in their final rule, that cannot be the case, that farmers could apply for a PPP.
Greg, let me, an unusual circumstance, but you may be right, but I would tell you that I don't think that is now the answer. And so Congress specifically, including me, made certain that farmers could qualify for PPP, this program, this loan guarantee through SBA. That is true. Farmers qualify, and I've talked to farmers who have received loans. Okay. There is another SBA program that at the moment, it's related to, it's a program that existed. It wasn't one that Congress created, but farmers were excluded from it. And it's a program that has been around for just natural disasters, a tornado or a flood, and farmers have not been traditionally eligible for that program. I think many of us in Congress, the Aggies in the Senate, believe that we made certain that farmers were eligible for that program. So we're working to make certain that becomes true. But in the meantime, this program is available for sole proprietors who happen to be farmers, or farmers who employ people are eligible for this SBA loan guarantee. And if any farmer or their lender is having any difficulty in that being true for them, make certain they reach out to me and my team, and we'll go to bat with the SBA. We'll help their lender. We'll help that farmer.
All right, got a couple more things here, so we're going to run over just a bit. This thing has so many spokes in the aspect that I know you're concerned for rural hospitals, but also for airports as well. And I know you've tried to secure funding through that to help them out in any way they can.
Greg, you're right. I mean, when you look at agriculture or rural America, farmers and ranchers have to be doing well for a bright future for rural Kansas, but also keeping those hospital doors open, a physician and community, other healthcare providers, often determines the future of small towns and really large towns across the state. And we were successful in getting a significant amount of money into this Phase 3 bill, $100 billion. When I first described it coming from Washington, D.C., I had the word million in there, but it's billion. And the first tranche, the first section of that money, it's being taken out of that $100 billion in 4 steps. The first step of $30 billion has and is being distributed to Kansas hospitals. And in the part of Kansas that you and I come from, a county hospital is receiving someplace around $300,000-$500,000, and of course, larger hospitals with more patients are receiving more. And the challenge is that our hospitals are not admitting patients for routine services, and they're saving the PPE, the personal protection equipment, for the crisis that may come. And so they're not getting the revenue that comes from their normal business, and yet their expenses are going up. And we know that almost without exception, and I don't even know that there's an exception, our hospitals in Kansas hang on by a thread as far as financial margins. And so this money is designed to make certain that they have cash flow. There's several other programs that are helpful to our healthcare providers as well, but we're paying close attention, and we think we've gotten money into the hands of hospitals across Kansas over the last week that will be very helpful, not to the hospital necessarily, but to the citizens who need that hospital in their community. And airports and other, the magnitude. Let me say this: we are spending huge amounts of money. There are things in this bill, this CARES bill, and the other previous packages that wouldn't be things that I particularly like or wish that were in there. But overall, I think this package was necessary, and I ended up, it passed the Senate 96-0, a 96-0 vote in the United States Senate in today's divided times almost never happens. But my view is that we need to, this is through no fault of the people out there, we need to take the steps necessary to see that we care for them, that they can help pay their bills and survive economically during this time and get their health care assured. But we also need to make sure that this doesn't become the size and scope of government into the future. As the COVID virus disappears, there's lots of things we need to be doing, but keeping government spending and intrusion in our lives to the degree that it is right now is nothing that I find acceptable. I would say that in the future, we need to make certain that I'm going to do everything I can to make certain that we are not reliant upon another country, China or someone else, for our medical supplies, our vaccines, our prescriptions, and our personal protection equipment in the future. We need to bring this stuff home so that it's available to us in time of crisis. There's a lot of things we need to do to be in better position, but one of them is not to rely upon the Chinese for the supplies we need to combat this virus.
Senator, one final thing, and you've heard the president talk about this the past several briefings about getting the economy open, and I know many are wondering, when is that going to be, as far as getting the economy open, but also taking the health issues in mind. How do you feel like this is going to play out, or how do you feel like it should play out as far as eventually getting things back and going again?
Well, clearly our country can't afford to have the kind of shutdown that we have going on now. Our economy cannot tolerate that, and what by that I mean people earning a living and caring for their families. And so obviously the earlier that we can get back to whatever normal now becomes is important. I think we're waiting on, and it does have to be, you cannot absolutely look the other way and say that lives that will be in jeopardy if people are out and about. Those are important, and our primary responsibility here is the health and well-being of Americans. So I think at the moment, at least talking to the experts, I would rely upon a lot to do with science and medicine. And what I'm told is that we are, by those experts, two things that we're waiting to see. And one is the social isolation, distancing, the no handshakes, the things that we've been doing, how successful is that effort? Is it really bending that curve that people talk about, flattening it? And the answer seems to be yes. And in fact, the models are now indicating that because of that, fewer deaths, fewer hospitalizations, and fewer positive tests. The second part of that is, does warm weather, does spring and summer take the viability of this virus's spread out of the virus? And we're waiting to see what happens with the changes in our seasons. And that, if that's true, and that's true of most viruses, if that's true here, again, it helps us speed up the process of getting us back to closer to normal. So again, I would only highlight one more time is we need more tests. That means we need more PPE for lots of reasons there. But assuming that we can get people tested across Kansas and across the country, a lot of people can begin resuming their activities once we know individually what risk they are at.
All right, Senator, we're way over, so I appreciate you hanging on with us. And as always, I appreciate the update. Thank you very much.
Greg, I look forward to getting back to the normal days of talking agriculture.
Exactly. It's Kansas U.S. Senator Jerry Moran is joining us on the Ag Issues program here on 580 WIBW.